All right, as Republicans now gear up in the House, ready to what they say is dismantle the new health care law, some Democrats will help push the overhaul through. Seem to be having second thoughts. Senator Claire McCaskill out of Missouri now says Democrats should consider scrapping the mandate that requires Americans to buy health insurance. She's expected to face a tough re-election campaign in 2012, and she is not alone. Jason Altmire is a Democrat out of Pennsylvania. He voted against health care last year. He also won re-election. And good morning and welcome back here to America's Newsroom. Will you vote to repeal this?
I won't vote for a straight repeal because there are provisions in the bill that have taken effect that are meaningful and that are positive. Closing the prescription drug donut hole for seniors, the fact that you can't be dropped from your health coverage if you get sick or injured, the ability of children with pre-existing conditions to access for the first time the insurance market without restriction. These are good things that were in the bill. I voted against the bill because on the whole I believe, and I still believe, that it did more harm than good. But there's no reason that the repeal has to be structured in a way that you literally throw the baby out with the bathwater.
But many of the things, right? But many of the things you're describing has bipartisan support. It's not even being debated.
I agree, and that's what's in the repeal bill. If we could remove those provisions, they have wide bipartisan support across the country. I think everyone agrees those are things that needed to be done. They were popular before the health care bill was being debated. Let's take those off the table, and let's repeal everything else.
We're getting somewhere here. So you would take out the mandate to require Americans to buy insurance.
I've already voted to repeal the mandate.
You take out the pre-existing conditions. You take out closing of that donut hole for seniors, and you'd vote for repeal.
Well, I've already voted for repeal of the mandate. I have already voted for repeal of that onerous 1099 provision for small businesses relating to tax paperwork that they have to file. There's a lot of things in this bill that need to be repealed, and I'm willing to go line by line with Republicans and Democrats alike, and I think the bulk of the bill needs to be repealed. But I think it's crazy to structure next week's bill in a way that you're going to allow me to go back into my district and look people in the eye and say, yeah, I voted to repeal the prescription drug donut hole being closed. I voted to repeal the fact that you can get insurance for the first time with a pre-existing condition. I'm not willing to do that.
Okay, how many Democrats do you think will vote with Republicans next week? Wednesday's the big vote, by the way, on the 12th of January.
Right, 12th. I don't know because there's 13 Democrats remaining who voted against the health care bill, myself included. I've talked to a lot of them. I think we all have the same concerns. We think, by and large, it was a bad bill. It did more harm than good. But to repeal it all, including the few provisions that were beneficial, just doesn't make any sense.
So do you think any Democrats will vote to repeal it?
Yeah, there's a few that are announced, but I don't think you're going to get more than a small handful.
Wow. So what the Republican strategy seems to be then, they vote on the repeal. It goes nowhere on the Senate side, but they'll chip away at this bill, and they'll chip away at it in time. Do you feel safe today to say publicly that as we look at this 2,000-page health care bill, that in the end it will be nothing like it is today when it's applied to the American people?
I'm willing to help with the process of going line by line, repealing the onerous provisions. I'm not able to say whether or not he's going to go along with that, and certainly the president is still the president. He's going to veto a lot of that. So whether ultimately you can be successful, I don't know. But I think that it is healthy to go through the bill and look at what was in it, because the American people still don't have a good idea of what was actually in the bill.
Republican leaders and that, they still don't have an idea of what's in the bill. Do you?
Well, I read the bill. Yeah, I'm on one of the committees of jurisdiction, so I was involved right from the start. So I feel like in the implementation process, I certainly know what's been implemented so far, and I know what is a good part of the bill. But I do think, by and large, it was more harm than good.
Republicans believe once the vote is taken, that puts pressure on the Senate. Do you agree with that in principle?
No, it's not going to pass the Senate. Everybody knows
so it doesn't matter. But ultimately, like with that mandate clause, that's being battled in the courts right now.
Well, that's right.
In the end, it may not be the House or the Senate that has any say in this. It might be the courts that ultimately decide its implementation or not.
The Supreme Court is going to decide if it's constitutional. If it's not, then that makes it easy. But if it is constitutional, then the Congress could still repeal the provision, but the courts could strike it down, and that would make it easy for everybody.
We're trying to figure all this out as we go. Next Wednesday's the big vote. Jason Altmire is a Democrat out of Pennsylvania. Thank you for your time.